Have you ever thought what is the thickest nerve in the body? Well, the sciatic nerve is the thickest nerve in the body. It is the nerve of the posterior compartment of the thigh. It arises from the sacral plexus in the pelvis and consists of two components, namely the tibial component and the common peroneal component. The tibial component arises from the ventral division of the anterior primary rami of L4, L5, S1, S2 and S3 spinal cord segments, whereas the common peroneal component arises from the dorsal division of anterior primary rami of L4, L5, S1 and S2 spinal cord segments. Now that we have learned the origin of sciatic nerve, let us see its course. The sciatic nerve, after its origin in the pelvis, leaves it through the greater sciatic foramen inferior to the piriformis muscle. It lies on the ischium, obturator internis, quadratus femoris and adductor magnus. The sciatic nerve descends between the greater trochanter and ischial tuberosity. It enters the posterior compartment or the back of the thigh at the lower border of the gluteus maximus muscle. It is crossed by the long head of the biceps femoris muscle. The sciatic nerve terminates at the superior angle of the popliteal fossa by dividing into the tibial and the common peroneal nerves. In the posterior compartment of the thigh, it supplies the hamstring muscles, namely semitendinosus, semimembranosus, biceps femoris, and the ischial part of the adductor magnus. The compression of the sciatic nerve leads to a clinical condition called sciatica. It is characterized by shooting pain that is felt along the course of distribution of the sciatic nerve, and the temporary compression of the sciatic nerve at the lower border of the gluteus maximus muscle against the femur causes sleeping foot. In Piriformis syndrome, the sciatic nerve is compressed by the piriformis muscle. This can cause pain in the buttock. Well, that wraps up a high-yield overview of the sciatic nerve.